What I do want to talk about, though, is a bit more from a governmental budget perspective, and what are some of the arguments and challenges vis-a-vis governments in terms of putting investments into early childhood. And I think also the perspective is largely from the developing world and the kinds of dilemmas that it is facing, but I think there is a lot of resonance often with many situations that you find in the North. The problem, in a sense, is that universal primary education in much of the world has been achieved. There was a movement of education for all, which has been going on for 20 years, with a real push for universal primary school enrollment. And many countries have achieved that, or are close to achieving it, at least in terms of numbers, if not in quality. And therefore there's extra money lying around, and where do you put it? So ministries have to decide where, in fact, to put these resources. And there are strong arguments, for good or bad, and strong interest groups or lobbying groups pushing that this money be spent up the system in secondary education, technical education, higher education, rather than spending it down the system. And I think the dilemma, therefore, and the challenge is, how do you convince ministries of education, at least, to take whatever extra budgetary funds they have and think about expanding the system formally downward rather than only upward. And I think that is the real problem. So why is early childhood a challenge to ministries of education? Well, first of all, early childhood care and education, or ECCD, is a very messy, complicated process. It covers several areas. It's not only education, it's health, nutrition, protection, cognitive stimulation. Many of these are considered beyond the mandate and the experience and the competence of the Ministry of Education. I was recently involved in a large meeting in Thailand, which was a kind of 20 years of education for all. And the issue came up, do you put in the final declaration the role of the Ministry of Education in relation to children 0 to 3? And there was a lot of opposition to it because the ministers who were there said, well, we don't work with children 0 to 3. That's someone else's job.
Yes.
So it didn't get in the final declaration, despite the arguments being made that, in fact, through parental education, adult education, literacy programs, and all kinds of things, ministries do have something to say about the well-being of children 0 to 3. It's not only a complicated process, it's also a complicated subsystem, meaning there are other ministries involved, but you have also a very large non-government organization, NGOs, community-based organizations, CBOs, the private sector, very heavily involved in many places. And therefore, again, the ministry says, well, let someone else do it. There's so many other actors, we don't have to worry about it. We'll focus on what we do best, which is formal, usually primary schooling and upward. So let someone else deal with that messy subsystem. And as I said earlier, there's ever greater pressure to expand upward rather than downward. Why? Well, you want to ensure that adolescents and youth get better technical education so that they don't become unemployed or underemployed, and therefore they don't take to the streets. And one of the main incentives, I think, for the recent, whatever you want to call them, revolutions in the Middle East and the Arab states has been this issue of underemployment and unemployment of the adolescents and the youth. So you don't want that. You don't want dissatisfied graduates. There are arguments to develop the nation's economy, to increase its competitiveness in a globalized world. We need more money up the system, better universities, more technical vocational education. And those calling for these investments up the system are generally more urban, more elite, more influential, and louder than those who are talking about putting money down the system. You know, there are not a lot of people demonstrating in the streets to put more money into early childhood. There are not many elites who are, in fact, in one way or another, electing the leaders of governments who are saying, put more money in early childhood in rural areas. They're saying we need more university spaces. So this is a challenge. Now, what are the arguments about these challenges? Well, in general, and you've heard this probably a dozen times already in the last couple of days. Early childhood is the most important developmental phase in the human lifespan, and there's all the new evidence about neuroscience, genetics, population studies, which indicate that for many reasons this is absolutely true. The influence of a child's early environment and of its brain development, cognitive stimulation experience is long-lasting. Preventive early interventions yield higher returns compared to remedial services later in life. Rob made reference to that. You need less special education for children in primary school to get them up to grade level if in fact they've had a solid foundation in early childhood care programs. And then you have this growing number of extremely vulnerable and excluded children. Michael Kelly talked about those that are HIV infected and affected. Conflicts, natural disasters, child labor, disease, all of these lead to all kinds of consequences, especially among generations, higher rates of fertility, higher rates of infant mortality, unemployment, lower levels of education, health, and nutrition. So a growing number of, for various reasons, vulnerable and excluded children with serious consequences, many of which could be mitigated, at least, if you had stronger early childhood programs. So what are the arguments? And I'm reiterating some of those that Rob has made. Returns on investment, they accumulate over many years, and if they're focusing especially on usually excluded, disadvantaged, marginal populations, they accumulate more strongly over time. And some of the data are perhaps a bit different from Rob's, but it's different studies and different analyses, but in general the message is the same. For every extra year the average child spends in school, national gross development per GDP, gross development,
Gross domestic product.
domestic product. I told you I'm an anthropologist. It's 3 to 6% greater. So if you look at the average years of schooling of individuals in a country and correlate that with the level of GDP, you in fact find this kind of figure. Public investment provides the greatest returns, and this is the interesting comparison, not made so much, is that it's high, in the case I'm using here, 8 to 1 for early childhood programs, $8 back from every $1. But in fact, for primary school, it's much less, 3 to 1. And for adult training, adult literacy programs, it's basically 1 to 1. This is not to say anything against people who believe in adult literacy, but if you're looking at it from an economic argument, this is what one talks about. And again, there are longitudinal cost-benefit analyses like the Perry High School project, which Rob has already talked about. There's a poverty reduction argument. For individual households, an extra year of schooling actually leads to higher household income. 1 to 5% for primary school, 2 to 10% for secondary school. So again, strong foundation in early childhood, which encourages, allows, permits children to go into higher levels of education, increases household income. You have providing quality care and education, opportunities for children and families, especially most at risk, is one way to break this intergenerational cycle of poverty. Parents are poor, uneducated, children are poor and uneducated. How do you break that spiral, that cycle, which is often in fact a downward spiral, and early childhood will help you do that. And as some of you mentioned, parents need to work, obviously, to support their families. Therefore, they need dependable, high-quality early childhood development programs of child care. And employers, of course, also benefit. Okay? They benefit because the parents don't have to worry about having stable, good quality care for their children. There is an argument that I think was not mentioned through the audience participation, which is the health argument. One reduces through early childhood care and development programs, starting especially at prenatal years, you reduce the number of high-risk parents, malnourished, underweight, ill, both in this generation, but also in the next generation, children coming out, coming from mothers who are ill or malnourished. One is decreasing emergency and hospital services. There are fewer high-risk behaviors, which lead to